Hi, I'm Ekta. I'm one of the clinical practice leader CPLs at SHN. My role primarily is on the medicine units, but I'm also one of the CPLs for the Supervised Practice Experience Learner Program in collaboration with CNO. So I thought the courses were great. I think a lot of the concepts that were taught in these courses by Global 369 are not necessarily covered in their nursing programs that they do back home, or even kind of those courses that they have to take here in Ontario or in Canada. So I think it's really important for everyone to have a really good sense of the Canadian healthcare system, because those are sometimes the biggest struggles when you are transitioning from back home to a country like Canada. So concepts such as financial literacy, cultural diversity, a lot of those are very different in other parts of the world. So kind of taking those courses to get some more insight on how the Canadian healthcare system works, I thought would be very beneficial for the students. And there was a decent amount of nurses that joined for medicine. So a lot of them very positive feedback. They said they learned a lot. Primarily, I think the big focus of their learning was financial literacy. So we often, as women in our roles, I think back home, their responsibilities were a little bit different. So now they come to Canada, managing budget, managing finances. It's a dual responsibility between a husband and a wife if you're married. So I think kind of partaking in those responsibilities was eye-opening for them, helpful, beneficial. Again, transitioning into the Canadian lifestyle, which they spoke highly of. It's great. So SHN is always kind of looking to include every staff. Like Michelle James said, we want to include every staff, every cultural background, every different type of nurse staff that we have in the hospital. So I think partnering with Global 369 and having the opportunity to get our teams learning these different concepts, which ultimately help them in their growth and learning as nurses, as professionals, as people and daily life, I thought was great. And we're definitely looking forward to the next cohort if there is an opportunity to do a next cohort.